And all of those things together got me to a place where today my tinnitus is a little bit of a buzz, but it doesn't bother me.
Dr. May has been an audiologist for an impressive 18 years, dedicating her career to helping patients with tinnitus. I wanted to share a quick word here as we get things started. So, quick introduction about Treble Health. We're a telehealth practice of doctors in audiology who specialize in tinnitus. You may also know us through our YouTube channel, which has over 20 million views, and we have over 1,000 reviews via Trustpilot.
I wanted to start off today with first just a kind of an understanding of tinnitus and kind of what it is, just kind of a brief overview. And if you're here today, you probably looked up tinnitus and you've probably heard the definition given that it is an external sound without, or sorry, it's an internal sound without an external source, meaning it's not coming from outside the world, but coming from inside of our body. And whenever I hear that, I like to kind of go in a little bit deeper and talk about how that this is an electrical energy. Tinnitus is an electrical energy in our body, and it is being sent up to our brain and is being marked as a danger or an alert sound. Tinnitus is typically described as ringing, buzzing, humming, but really it can be any sound. And I think I've heard just about everything described to me when people are talking about their tinnitus. Personally, I have tinnitus, and my tinnitus started off as kind of a roaring sound like a jet engine. And throughout my time of having tinnitus, my tinnitus has actually changed sounds. I've had a generator, I've had a tea kettle, I've had nails on chalkboard, I've had an ambulance siren, and currently it sounds like high voltage electrical wires. So it's kind of interesting to know that it's something that can change. And when we're trying to understand tinnitus, it's really important that there's a lot of things that can cause tinnitus. And we try to kind of take these causes and put them into three subtypes of tinnitus. There is the cochlear subtype, which has to do with hearing loss or trouble with our auditory nerve. Now, one thing to know is that you can actually have a normal hearing test and you can actually still have some damage to the auditory system that's not showing up on a hearing test. There are specialized tests called an OAE that can investigate a little bit further to see if you have any damage. The second subtype of tinnitus comes from somatic, what we call somatic tinnitus. And that is going to be coming from physical issues like from the neck. Examples would be asymmetrical neck conditions, arthritis, bulging discs, concussion, whiplash, TMJ, temporal mandibular joint disorder, wisdom teeth, grinding, clicking, popping, those types of things are going to be your somatic types of tinnitus. And our third subtype is central, and that is exactly what it is described. It is central in our brain. These are usually coming from anxiety, depression, OCD, maybe even ADHD. Some of those central type disorders can be a cause of tinnitus. So those are the three main types to kind of keep in mind when we're going through this. The other thing is, one of the things is we know that there is a great range of impact when it comes to tinnitus. I'm sure that if you've ever talked to a loved one or a family member and you've told them that you have had tinnitus, they might have told you, oh yeah, I have that too. Can't tell you how many people have told me that. But we know that it can range from non-bothersome to very disruptive. It can affect our mental health. It can cause anxiety and depression. It can affect our sleep, falling asleep, staying asleep, and even affect our relationships with our loved ones. So it can be very disruptive. So why does this happen to us, right? So when we're talking about tinnitus and the auditory system, it's important to understand that there is this connection to what we call the limbic system, which is our center in our brain for handling our emotions, and our amygdala, which is in charge of our fight or flight response. The hearing is so important to our brain and our body that it is one of our first sense out of all five senses that is fully formed and functional. At 18 weeks of gestation, the baby inside mom can actually hear her internal noises. It can hear the blood flow, it can hear her heart rate, it can hear her tummy gurgling, and it is starting to hear. At 6 months of gestation, baby can now hear the outside world, and the mom is told, sing to your baby, talk to your baby. And some studies have shown that there is a relationship between that and now up to our brain. And this connection of the mom has got very lots of hormones going and lots of chemicals of dopamine and serotonin, which are our happiness chemicals in our brain, then the baby's realizing, oh, that is a happy sound. But if mom's heart rate increases and her stomach tightens and she gets stress cortisol, the baby's starting to realize there's something going on with loudness. So these connections are formed early on, and that's because for safety purposes for our brain, hearing alerts us to danger first before any of our other senses. And so with tinnitus, what's happening is you have this electrical signal going to your brain, and your brain doesn't know what this signal is. And so it will check back with your system and say, hey, what did you send me? And the ear says, I don't know. You're the brain. You figure it out. Let me send it again. And so now we have this up and down motion of this electrical signal going up to the brain and back down, this up and down checking, if you will. Next, the brain, the amygdala, goes, uh-oh, we have a problem. And then we'll start to flood the brain with chemicals such as stress cortisol and adrenaline. And that will in turn put us into this fight or flight mode. What happens when you're in fight or flight is your breathing will become shallow, your heart rate will increase, and your muscles will tighten because your body is getting ready to either fight off an enemy, fly away, or trying to figure out maybe it needs to freeze in place. And so your brain is trying to figure this out. I usually use the example of if you've ever been hiking in the woods and you hear a crunching in a distance, you're going to stop and listen. And you're trying to figure out, okay, is that a danger sound or is that an okay sound? And do I need to run away or walk away and get away from that? So that is what our brain is doing with tinnitus, is it's trying to keep us safe from a sound that doesn't need to be causing danger. Also inside the brain, instantaneous or changes are made when you have tinnitus. So I like to call them little roads. These neural pathways are formed all over our brain. Think of it as the brain is now looking for a reference for your tinnitus. Do I see something in the environment? Am I smelling anything that's going along with that hearing? Am I tasting anything, touching anything? And so these neural tracts are formed all over the brain. The second thing that starts to happen is that memories are made that this sound equals danger. We need to remember that that sound equals danger. If it was me in California, like Dr. Ben, if I'm out hiking and I hear a rattle, I know that's a rattlesnake and I need to move away. So I want that memory of that sound being dangerous. But unfortunately for tinnitus, the sound is not dangerous. And so you can see where our brain is now getting confused. And in turn, what happens is now realizing that this is an internal situation, this can lead to some negative thoughts, some negative emotions, and some negative behaviors. And so that is what we're going to talk about next. How can we stop this fight or flight response when we are having tinnitus? Well, we know cognitive behavioral therapy techniques can help us with the fight or flight response, and in turn, change this into a rest and digest response. So, for example, if our body is going into fight or flight, the breathing shallows, the muscles tighten, the heart rate increases. If you're going into rest and digest, what is happening is the muscles loosen, the breathing gets more deep, the heart rate slows down. It's basically the opposite. And so CBT or cognitive behavioral therapy can actually take us from one way to the other. It can calm our body down after danger has passed. And it can help us by changing the patterns of the reactions to our tinnitus. It can help us develop coping strategies and shift our responses more to the neutral. We're going to have to teach our brain how we can rethink about this sound. So, how does CBT help, right? How much does it help? Well, CBT studies have shown that it can really help in treating tinnitus by reducing our emotional distress 50 to 30 to 50%, which is a really big number. It also can improve our quality of life by 50 to 80%. And CBT has been found the most helpful when combined with other techniques. For example, at Treble Health, we use multiple approaches to helping tinnitus. We use tinnitus retraining therapy, which is about demystifying the anatomy and how the ear is working. We use some cognitive behavioral therapy approaches. We use acceptance and commitment therapy approaches. We use sound therapy, and we kind of combine this all together into one big program to help our patients. And we have been very successful in helping our patients, and something that I'm really, really quite proud of. So, what are some techniques? There are a lot of CBT techniques that can be used when it comes to tinnitus, and we're going to talk about 5 practical techniques right now. The stop technique, 5-4-3-2-1 technique, 5-finger breathing, progressive muscle relaxation, and imagery.
Dr. Suzanne, may I ask, we do have one question from Nancy,
Sure.
which I think is a great question, and that's my role here to just jump in and help with some
Yep.
questions. Nancy asks, does CBT and will these techniques help all causes of tinnitus?
Yes. That's an easy answer. All 3 subtypes, we've known that CBT can help with all 3 subtypes of tinnitus. So we're first going to talk about what is called the stop technique. So this is a cognitive behavioral therapy technique. And the way that I like to first talk about it is that it is an acronym that has each letter stands for a different part of the word. The first one, the S, stands for stop, just what the acronym says. I want you to pause. I want you to take a moment. I want you to say to yourself in your head, as soon as you notice your mind racing, your body reacting to triggers and stress, stop. Let me just hold on for just a second. The T is for to take a slow, deep breath. We're going to go in through our nose and then out through our mouth. I want you to picture your breath really filling up your lungs like a balloon, your diaphragm like a balloon. You're really expanding that lung capacity and you're breathing out and you're deflating the balloon. One thing that's nice about taking a deep breath is that it will lower our heart rate. It will lower our blood pressure. It will lower our stress cortisols in our brain, and it will increase our oxygen. So it's starting to take our body from fight or flight to that rest and digest, and by changing how our body is reacting physically. And now our body can tell our brain, we're not in fight or flight. We're taking a deep breath, which we wouldn't do if we were in fight or flight. So now the brain goes, oh, okay, hold on a second. Something's changed here that I need to kind of think about because I'm not being chased by a bear. Okay, so those are the 2 steps, first 2 steps in stop. The next 2 steps are first O for observe. Now, with observe, we can notice the thoughts going through our brain. We can notice our emotions. What are we feeling right now? It's really important to recognize what it is that you're feeling. Am I feeling anxious? Am I feeling scared? Am I feeling annoyed or angry? But also, what is my body doing? Am I feeling like my muscles are tight? Is my breathing shallow? Is my stomach upset? And we're going to see if we can stop our urge to react impulsively at this point. We're just kind of observing all of these things. And then the P in stop is to pull back, put things in perspective. Don't believe everything that you think. Your thoughts are not facts. And actually, they're usually wrong. So this is a moment to kind of reflect and say, okay, hold on a second. I am reaching out for help. I am trying to work on my tinnitus. I am doing these things to get myself better. Okay. So you will get through this. So stop technique is a really, really great CBT technique. The next is going to be 5, 4, 3, 2, 1. This is a grounding technique in cognitive behavioral therapy. And really, it is about engaging all of your senses. What we're trying to do is take your focus away from the tinnitus and onto something else and teach your brain that it's okay to focus on other places besides our hearing. And what you're going to do is you're going to start off with 5 things that you can see right now. And we don't want to do just surface things. We actually want to give a lot of details. So when you're doing this, you're going to do this all about the details and you're going to do 5 of them. Next is 4 things that you can touch. And what I want you to do is try to find things that are different temperatures or different textures. 3 are what are 3 things that you can hear that are not your tinnitus? And again, details. Next on this list are 2 things that you can smell. And I usually recommend trying to find something that is a little bit stronger of a scent. And then last but not least is taste. And again, things that are sour, sweet, bitter, salty. And what we're doing again, we're trying to distract our brain away from our tinnitus and onto our other senses and teach it that it can focus in on other things. Okay, you guys hanging in there? Excellent. All right. So going back to breathing again, as we've learned, breathing is really important. And so this is probably one of my favorite breathing tools because it's incorporating not only breathing, but we're going to incorporate our sense of touch and our sense of sight. So it is 5-finger breathing. And basically all you have to do is take your hand and spread your fingers out like this. And you're going to take your other finger and you're going to trace the outside of your hand. And anytime you're tracing your finger up your hand, you're going to breathe in through your nose. And anytime you breathe out, you're going to be tracing your finger down. So together we're going to breathe in and then we're going to breathe out. And we're going to keep doing this for all 5 fingers. So I usually joke that it's nice that it counts for you. We have the tactile touch by touching our finger. We are watching our hand go up and down. It's keeping our focus on our hand away from our tinnitus. And it's just a really nice way to kind of ground us into our breathing and, of course, get us from that fight or flight into rest and digest and calm our muscles down, relax those. Breathing is nice and open. So that is another good one for you guys to do. All right. Progressive muscle relaxation. Now, progressive muscle relaxation really is about trying to teach our body, which is nice and tight and ready to fly away or fight off an enemy, to relax and kind of decompress and to loosen up. So you want to sit back in a comfortable position when you're doing this, maybe on a chair, maybe lay down, and you want to basically tense your muscles one group at a time. I usually recommend when you're tensing, again, you're going to breathe in, and as you're relaxing that muscle group, you're going to breathe out. This is a really good one to use prior to sleep, by the way. So if you're struggling with sleep, this is one that you can use before sleep to try to just relax all your muscles. I kind of add one onto this, which is at the very end, if you're trying to fall asleep, you're going to relax all your muscles, entire body, pretend that you're melting into the bed, and hopefully be able to drift off to sleep. So this is a really good one for that. But this is something that you could do at any time of the day. If you're feeling like you're anxious, you can start to kind of just tighten these muscles and relax these muscles. All right, next we have imagery. And so if you struggle with meditation, this is kind of a really nice substitute because it's a relaxation technique that's going to use our imagination of a peaceful and safe place. And it's going to, again, involve all 5 of your senses when you're imagining that space. So I want you to think of something that makes you feel calm and cool and comfortable and something that makes you feel very safe. Now, this could be any number of things. This could be the beach, this could be camping, this could be fishing, this could be hiking, this could be baking cookies, riding in an airplane, you name it. I think I've heard it. Whatever makes you feel comfortable. You're going to sit back, you're going to relax, and you're going to picture that in that place in your mind. What are you seeing? So if I pick the beach, which is kind of my go-to as a California girl, I'm going to picture white sandy beaches, turquoise water, sunshine, sand, umbrellas. That's what I'm going to picture in my head. Next, I'm going to figure out what am I hearing? Again, that's not my tinnitus. I hear the waves. I hear the wind. Maybe I hear the seagulls, right? What am I smelling? Well, I can smell my suntan lotion, the salt in the air. What am I tasting? Maybe I'm tasting a lemonade. And when I first started doing this technique with tinnitus, I needed some help. So I would get a picture of a beach in front of me. I would get myself and I would put some sun lotion on my skin. So I would have the smell. I would get a towel for my touch. I would get lemonade for my taste. And I would play waves from a speaker. So I would have the sound and I would sit there with all my stuff around me. And I would look at the picture and then I would close my eyes and try to visualize that in my head as I try to relax. This again is another great one for helping with sleep because it can really help kind of relax the body. And so those are kind of my kind of quick, very easy tips of if you're feeling anxious about your tinnitus and you're not sure what to do, these are 5 CBT techniques that you can use right now at any time to help you get out of that fight or flight anxiousness mode and hopefully move towards that rest and digest mode. So I hope that is helpful for you.
Dr. Suzanne, we have some questions. I'm going to start with this one right here. How do you deal with your own tinnitus?
So how I manage my own tinnitus is my tinnitus 5 years ago, I had a head injury. And so I actually have a kind of a combination of subtypes of tinnitus. And what I did was I did sound therapy, which is wear a device that would be on my ear that would play sound in my ear that was very relaxing to me. And that was like probably the most helpful thing. And then the next thing is I would use these CBT techniques. I did imagery. I did the progressive muscle relaxation. I did the 5-finger breathing. I did all of those things. I did stop. I did 5, 4, 3, 2, 1. Anytime I had tinnitus, I would use those. I did work with a therapist as well. I'm very open and honest that I did take medication to help me with sleep and help me with anxiety that I was having at the time. And all of those things together got me to a place where today my tinnitus is a little bit of a buzz, but it doesn't bother me.
Thank you so much. We're so grateful that you're giving back and decided to specialize in tinnitus care so that everyone here can learn from you through your personal experience, through your work with your patients. We have another question here which asks, how do you figure out which type of tinnitus you have if the ENT doctor is not curious to rule it out?
So, one of the first things that you'll probably want to do if you haven't done it already is go get a hearing test and check to see if you have any hearing loss. You can also have them run what's called an OAE, which is checking to see how the outer hair cells are functioning in your cochlea. There's a little part of your cochlea. And then if that is not doing it, one of the things that we do at Treble Health is this root cause ID. And so we are going to ask you a lot of questions about your medical history and see if we can figure out, is this coming from your cochlea? Is this from your neck or your jaw? Is it central? And so we can kind of help, kind of, as my 14-year-old would say, suss this out. We can kind of dissect it and see if we can help you figure out your cause.
Thank you so much. I'm going to share for a few moments here, building on what you said about the root cause ID. It's one part of what is called the Tinnitus 180 program with Treble Health. So let me go ahead and share more information about that. Tinnitus 180 is a name we chose because when you can reduce tinnitus, you can really improve your life and turn your life around 180 degrees. Lewis, for example, worked with Treble Health. He worked in our program and he found relief in 6 days and eventually graduated from working with us in 106 days. And he achieved what is called stage 4 habituation, meaning that his tinnitus became so far in the background and so low in his awareness that for a vast majority of his day, he didn't even notice it. right? And often during that process, the volume changes as well and lowers. So this is the kind of result that we want for each of you. Here's Annie, another patient who worked with us in the Tinnitus 180 program, and Annie experienced significant relief in 14 days and graduated from the program in 75 days. She worked with Dr. Ramsey on our team, who's actually in the chat answering some of your questions. Thank you, Dr. Ramsey. And really the core thing that Annie wanted to share was that she was able to let go of tinnitus, find joy in her life again, have her life back. And when tinnitus treatment occurs, that's the kind of results that we would expect. There's three components of the Tinnitus 180 program, which is our core program at Treble Health that I want you guys to know about. The first piece of it is called the root cause detection. It's also called root cause ID. Our doctors, like Dr. Suzanne Ramsey, like myself, we would take an independent assessment of what are the factors and causes of your tinnitus, and then we would provide a clear instruction of here's the root cause, here's what's going on, here's why you have it. And then from there, we personalize the treatment so that you get a treatment that is associated with the cause of your tinnitus, right? Tinnitus is a symptom. The cause of tinnitus is what we want to address. The second pillar of the Tinnitus 180 program are smart sound devices. I'm holding some up on the screen right now. And essentially, these are devices that sit up and behind the ear that play sound therapy into your hearing system. And those are specifically programmed for the type of tinnitus you have, the sound you hear, how loud it is, and those are adjusted over time as your tinnitus gets better. And then finally, the third pillar here in the Tinnitus 180 program is referred to as the brain retraining sessions. And a lot of what you heard tonight from Dr. Suzanne, this is an example of the one-on-one care that can be delivered through telehealth over Zoom, just like this, and getting to work through these strategies amongst others to help you reduce tinnitus. As part of the Tinnitus 180 program, this is a science-backed program. So we have research that supports our program and the outcomes. And because of that, we're able to offer the Tinnitus 180 guarantee, where we guarantee results or your money back. That means a significant reduction in tinnitus within 180 days, or you receive a full refund. Dr. Ramsey and Dr. Jackie, if either of you guys have some questions that have come through in the chat that you'd like Dr. Suzanne and I to answer, I would really love for you to unmute yourself and go ahead and share some of the great questions from our community. As you get those prepared, Dr. Suzanne, I'll ask you one, which is if someone has a high-pitched ringing tinnitus, what you're talking about tonight is more of the CBT techniques and more of the psychological piece of tinnitus. What does the sound therapy do? Maybe you have some devices that you can show. Like, what is sound therapy and how does it actually work? How has it worked for you?
So there we go. This is my device actually that I have. I just pulled it up here. Technically, it's actually was designed to be a hearing aid, but what we do at Treble Health is we modify it to be doing sound therapy. So it does go over the top of your ear here, and then you have a little wire that goes inside your ear here. And so it's not very noticeable, even if I put my hair up and I can show you there it is. It doesn't bother my glasses. My glasses just slide right on and off with it. And what it's doing right now is that I have mine set. My default sound is a wave right now. And so right now it's got this lovely beach wave that is playing in my ear and is soft in the background. And I tell people what the sound therapy is doing is it's giving your brain a reference point. So your brain doesn't have a reference from the environment on the tinnitus. And this is giving it something to say, okay, hold on a second. Both of these things are constant sound. Sound therapy and tinnitus are both constant. They both are auditory only. We're only hearing them. They don't have language. Those three things are in common. The difference is I care about my tinnitus. I don't care about this sound. This sound doesn't bother me. And what happens in our brain is it starts to rewire. So that's how it works in a nutshell.
Excellent. Thank you so much. Totally agree. Dr. Ramsey, any burning questions you'd like to ask us, and how are you doing?
I'm good. I'm typing away here. There's been a few people want, let's address, even if we're not in fight or flight, will these methods help us? So, regardless of the stage in this journey we're in, how will these methods help?
I was thinking more like along the four stages of habituation, which is that you go through these stages with tinnitus where you go from very anxious, very upset in that fight or flight mode when you're in stage one to, stage two being a little less anxious, stage three, you're more annoyed and more angry in stage three, and then four is finally acceptance. But you can use these techniques at any stage along the way. So you could be just annoyed by your tinnitus and go, okay, hold on, let me do that stop technique. Let me do 5, 4, 3, 2, 1. Even if I'm feeling annoyed, because with CBT, we're trying to change that emotional component when it comes to tinnitus.
So earlier it was asked if someone wanted to speak with a specialist on our team and get some of their questions answered. Maybe they have questions about the Tinnitus 180 program. Maybe they have questions about the root cause of their tinnitus or the best treatment solution for them. Then I do have something for you guys on the screen right now. So if you're watching this from your computer, then you can take out your phone and open up the camera, and then you can scan this QR code. What that will do is you'll be able to schedule a consultation with a specialist from our team at Treble Health. So again, if you have personal questions, if you want some help with tinnitus, if you want to speak with a specialist who can answer your questions, then scan this QR code on the screen. Dr. Ramsey or Dr. Jackie, any final questions here as we wrap up?
There's been so many good ones. Here's one. Suzanne, what does habituation mean?
So the definition of habituation, if you look it up on Google, is actually it's a decrease in the physiological and emotional response to a frequently repeated stimuli. And basically broken down, what that means is that you have these physical responses like the heartbeat racing, the shallow breathing, the muscle tightening. Those are your physiological responses. Those start to decrease as you go through habituation. And your emotional responses from the panic, anxiety, annoyance, anger, those start to dissipate as well. That is what habituation is. So it's kind of a twofer that you both of those systems start to decrease as you get through habituation and you get to a point where tinnitus perception also typically goes down and you are now feeling a lot more neutral to your tinnitus. A great question.
Guys, for those who are here, I just want to give a shout out as we're wrapping up here in the next few minutes and say we really appreciate you being here. I want to give a virtual round of applause to Dr. Suzanne May for leading an excellent presentation. Thank you so much, Dr. Suzanne. Any final words here for the tinnitus community and those who showed up live?
I always just always love to add at the very end of all of these webinars that we do that there is hope and there is a way that you can get through tinnitus. So hang in there. You got this.
Thanks so much. Good night, everyone.